for transparency and the idea that people ought to be able to shop for healthcare the way they shop for other kinds of goods and services, the moment for that has truly arrived. And that in many ways, we have common ground with healthcare workers, and that we at Leapfrog need to stand with healthcare workers, and that we need to be recognizing that all of us have a common cause in improving the healthcare of our country, that the systematic problems in healthcare are affecting not only the patients and the purchasers, but also the people who work in our healthcare system.
One of the most important things to keep in mind right now is that there's never been a more opportune time to try to affect change in the United States.
I think too long physicians have been on the sidelines, and I think choosing wisely is an example of them actually owning and taking responsibility for removing waste. And I think it's something to build on to really advance our agenda of improving quality and safety.
How do we think about really creating a safe environment for our providers, physical and psychological, so they then can deliver the best care to patients?
Nurses are critical to patient safety. We need to make sure they have the training and skills, and I'm suggesting that we are having more of that. I think there really is a value around transparency and saying this is our job. We need to step up and urge our hospitals to be part of the surveys that they need to be and in reporting quality for patients.
We need to intrigue and entice people of all demographics, literacy levels, and cultures to activate and engage as patients to the extent that they want to. We want to create one central place where every one of the 35 million people that go in the hospital every year, if they so choose, can tell their experience. They can do it in a succinct and meaningful way with the assurance that the data derived from it will help to drive system improvement.
I think we should say, I can guide you to a hospital that's going to provide safe and consistent and high quality care. And I can guide you as your family member, as your healthcare plan, as your employer, because I have access to that data, because I'm confident in that data's integrity, and because it's accessible to me in a way that will be meaningful and useful. So for me to achieve the kind of healthcare that I'd like to see my sons get, it involves you going out there and pushing harder, doing more every day, and challenging the status quo.